The first task is something of an icebreaker and sets the tone for the 2 following days.
As a group, you start talking to each other, you share your ideas. So this is a group activity. Also, while you're just going through those, do just refresh yourself on learning outcomes on page 4 as well, because that gives you an idea of what you should be aiming to achieve from these 2 days. Okay?
The students talk in their groups about what experience they each have of mental health, and then think about the key roles and responsibilities in mental health for medicine, social work, nursing and midwifery, pharmacy, and occupational therapy, as well as touching upon how stigma and discrimination may affect mental health service users. They also think about how the biopsychosocial model can be applied to mental health. During this time, the facilitators move around the room and make sure that all the students are fully engaged and able to ask questions should they like to.
If we start off, obviously you've shared your experience, whether formal or informal, and just to recap, we know that the social workers are on an MA programme in their first years, so there's various mental health. Nurses, you are in your second or third year? Second year. I know the medics are at the end of their third year, is that correct?
An important learning outcome is that the students understand the individual roles and responsibilities of the mental health care team.
Mental health, what sort of things did you have? Let's start with group 1. Cool.
We were thinking sort of more, assessment, diagnosis and management.
Yeah, and that's really the core of what doctors will be doing within mental health. Great. Table 3, what about social work? What are social workers doing in the mental health team?
Because we're getting quite into a bit of a discussion about the sectioning side of things, really,
okay.
and being enlightened by our social work friend over here. But there's, in terms of getting a patient into the inpatient setting, is more done with the mental health professional, and then working from there, really, and also sort of a lot of liaison with the family, and then in an outpatient, really.
Okay, so social worker may have a key role in terms of having to section a patient under the Mental Health Act, yeah? Thank you. The next table at the back, what about nursing? Do you have any nursing roles?
Building therapeutic relationships with the patient.
Good, building therapeutic relationships, yeah. Anything else?
I also put one-to-one communication and identifying any relapse signatures with the patient.
Okay, so in a way it's ongoing assessment as well, isn't it? Okay, excellent. What about the OT? Anyone have any thoughts about the OT?
Assessment of independent living.
Good, they can be assessing independent living skills, yeah. Anything else the OT might be doing specifically in mental health?
Cognitive assessment.
Cognitive assessments, okay. What do you mean by that?
Well, I used to work in stroke and elderly care, and the
Okay.
OTs there were often assessing, sort of even language things, mental ability, memory, and also looking at it very much from a targeted point of view of what interventions they then could help with in order to get the patient, back to the independent living that they were accustomed to before.
And it's a hard role to pin down the OT role sometimes, but it is about, and that's a really good summary, independent living, trying to promote that independent living, look for avenues where they can do things, particularly, obviously OTs also support patients in hospital, but we're particularly focused on community care, and it's looking at how to get people home, what sort of skills do they need to develop, what sort of support do they need to put in. So they have a very, very generic role around supporting the community there. Just very quickly, stigma.
Another key learning outcome is to learn about the impact of stigma on a person with a mental health condition. Therefore, it is a topic introduced early into the course and referred to throughout the 2 days.
Socially, really, just, people might say, well, stay away from that person, and they're really dangerous, whereas actually they might just be different to everybody else, and, people give you a wide berth because you're not quite normal, but at the end of the day, who's to say what is normal and what isn't?
What did you think about the psychosocial model? What do you think that involves? We're trying to move away from this idea it's medical model or social model. So when we try to put these 2 models together, what sorts of things do we need to be providing then for patients and service users to be inclusive of both the social model and the medical model?
It's the whole person.
The whole person.
It's the whole person. It's not just the diagnosis, it's how they live, the environment, their lives, what they would like in our lives. It's a massive, it's not holistic sort of care, it's everything.
And we've got to move away from this kind of artificial separation, one person, and the physical health is very important, but so is the social health, psychological health, etc.
We're constantly told we're quite structured in the care provided. That's where biosocial expands that care.
Good. And I think that's what you want to try to be looking at when you meet your patients this afternoon and you speak to the professionals tomorrow, to be thinking about this holistic care, this biopsychosocial model